Shared health, test out various different sort of pilot projects to see what works, maybe things that aren't traditionally being carried out in different parts of the health service. So this was a specific pilot project looking at promoting infant and parental mental health, so an infant parent mental health service based in primary care setting, which is really not a very common thing.
Much stronger in myself, mentally and emotionally, than I have the other 2 or 3 times I've had therapy. So it has made a big difference.
I never thought I could get help from just a GP, simple GP. But the help I have is amazing. It's amazing. I'm even surprised every time I walk in, it's like everyone knows me by the name. Oh, Tanisha, everyone knows me by name. So yeah, like a second family is warming.
The fact that you've got some sort of relationship with my GP, you've been able to go back and forth, and even without me having to tell you stuff, my GP shared that information, which was obviously allowed to be shared. So you've known where I'm up to.
And it made a change not having to go to hospital. I think if he'd have been based in a hospital, the whole process would have taken longer, it would have been more frustrating, and it wouldn't have helped the situation as well.
All of our fears and all of our issues we got to talk over with you. Like, it was just so valuable. Like that, it was like a proper bonus. Like better than any antenatal, like learning how to breathe or whatever.
And I'm sure that if we skip forward a few years, it's going to be in all practices, because it's definitely a gap in general practice.
From a clinical perspective, I think I've seen patients less because they've been more well supported in their mental health. I think we've probably seen more queries about their children's health. One family I can think of, I was getting a lot of queries about, oh, is this right for my child? Is that right for my child? And following their involvement with the service, you know, I don't have any phone calls like that anymore, because I think they're more secure in their parenting, and they're more confident in where they're at, and I think their mental health's probably a bit better too.